Hi guys, I hope you're having a good day so far. Today we have a presentation on brain tumours. The booklet that you all should have is related to the video, so all the tasks should make sense. There will be designated sections of the video where you can press pause and complete the tasks in the booklet. If you need any help, please contact either Sarah, George or myself. As previously stated, this presentation will cover the topic of brain tumours in application to plasticity and functional recovery. A brain tumour is simply a growth in the brain. There are two types of brain tumour. A non-cancerous tumour is benign and a cancerous tumour is malignant. Generally, causes for tumours are unknown. However, scientists have deduced that a patient can be at higher risk of developing a tumour through old age and prolonged exposure to radiation. As you already know, there are different lobes of the brain. Today, we will be focusing on the frontal lobe, the parietal lobe, the occipital lobe, and the temporal lobe. What you may not know is that tumours that develop in specific areas are given names. For example, the olfactory groove and the suprasalla are names for tumours that have developed in the frontal lobe. Parasagittal is a name for a tumour that has developed in the parietal lobe. Other names for tumours are clivus, foraminum, and cerebella, which are located in the brainstem and the cerebellum. Now pause the video and complete tasks 1 and 2 in your booklets.
Now, what are the treatments of brain tumours? We have medicines, surgery, radiotherapy, and chemotherapy. Please pause the video and complete task 3 in your booklets. Now, what is neuroplasticity? Neuroplasticity is the ability of the brain to form and reorganize synaptic connections, especially in response to learning or injury. This can occur in two ways, functionally or physically. Functional recovery is a form of plasticity in which, following physical injury or other forms of trauma, unaffected areas of the brain can adapt to compensate for those that are damaged. So the tasks that the damaged area would do are now being done by other undamaged areas. So how can we link brain tumours to plasticity? So when the tumour invades an area of the brain, it will damage it, and therefore it will affect the underlying functions. So this means that the brain will undergo reorganisation or plasticity to make sure those functions carry on. And the extent of this reorganisation or plasticity is depending on the extent of the damage. So this might be affected by the size of the tumour.
Evidence suggests that tumours can lead to hyperactivity in the immediate vicinity. This hyperactivity is neuronal. This means that the neurons start to do more work and transfer more electrical impulses to compensate for the neurons that have been destroyed by the tumour. The tumour growth may also trigger a reorganisation function in the brain. This means that functional control, such as the interpretation of visual and auditory information, may be transferred to other hemispheres of the brain. The brain has some repair methods to ensure that it is still able to work normally after it has sustained an injury. After a rupture or a disruption between synapses, new synaptic connections are formed to help the brain. Some other methods of brain recovery are axonal sprouting, reformation of blood vessels, and the recruitment of homologous areas. Axonal sprouting is the growth of new nerve endings which connect to other undamaged nerve cells to form new neuronal pathways. Reformation of blood vessels occur. The recruitment of homologous areas is where similar areas on opposite sides of the brain perform specific tasks. Now pause the video and complete tasks 4 and 5 in the booklet.
Now it's time for our case study. Our case study is a 6-year-old boy with a brain tumour, and his tumour caused seizures and he had no response to medication. However, the tumour was surgically removed, and after his surgery, most of the functions were taken over by the left side of the brain to compensate for lost nerve cells. This is also known as plasticity. Now it's time for the evaluation of our case studies. A case study helps to show true human behaviour and how the brain reacts. However, this is only one individual and we cannot generalise these results. so therefore it lacks ecological validity and, more importantly, population validity. Thanks for watching our video. Bye!